Hello, my name is Dr. Daniel Edward O'Connell. I'm honored to be selected as this month's Member of the Month for Nassau County Medical Society here in the state of New York. I was born and raised in Columbus, Ohio, and subsequently completed medical school at Loyola University Chicago Stritch School of Medicine in Chicago, Illinois. I finalized my MD studies in 2011 and subsequently was on scholarship for a Master's of Public Health program, which I completed at Brown University in Providence, Rhode Island the subsequent year. Following that, I commenced my formal residency training in internal medicine at New York Medical College, Westchester Medical Center. I lived in Elmsford, New York, adjacent to Tarrytown in Westchester County for about a year before relocating to the state of California to complete both my residency and fellowship in neurology and neuro-oncology, respectively, through UC Irvine and UCLA. Following completion of my formal ACGME training, I subsequently relocated to the state of New York and have been practicing since 2017 through the state of New York. I live here in Long Island, and I have been a member of the Nassau County Medical Society for some time and honored to maintain that membership for many years to come. I am a practicing board certified neurologist involved with both seeing patients in person and through telemedicine services. I'm also a military reservist in the Air Force Reserves. Moving forward, I must say that I have learned very much this year, 2021, and last year, just how pivotal and important teamwork is in the healthcare system. No one had the foresight regarding every single detail regarding the current pandemic, and the same can certainly be said for future epidemics and pandemics. As a military reservist, one of our roles is usually to support the active duty forces, but the heavy effect of this pandemic on civilians with comorbidities and our national patient population led to something of a role reversal this year and last with respect to working with active duty in many ways. Suddenly reservists became those sort of at the lead, treating more older patients, typically with comorbidities and such, rather than the mostly young and healthy soldiers that the active duty forces are more accustomed to treating. So we saw teamwork with that. We saw that role reversal effectively played out for the most part, and it was quite successful in New York City and elsewhere. And I must say, teamwork and a total force mindset significantly aided this national endeavor. And that doesn't just apply to military folks, that's for civilian folks as well at large, working amongst each other in these challenging times. That can be said for nurses, respiratory therapists, working within our ICUs, our wards, our ER teams contributing greatly to help with this pandemic, as the workload disproportionately affected their occupations, and certainly the respect that I and others have had for their labors as nurses and respiratory therapists and ICU attendings, ward staff, etc., chaplains included, has certainly skyrocketed due to this pandemic and the great work that they have accomplished. I suppose now that I've been a doctor for just over 10 years, I can chime in with respect to giving some level of advice for members of Nassau County Medical Society and future and current medical students. I would say that, and this can be found as a disclaimer statement on pretty much any medical textbook, especially test preparation textbooks that you'll find, that medicine is a constantly evolving science, and technological methods in delivering patient care, along with the ebb and flow of subspecialty relevance, also changes with time. What seems trendy today may fall out of favor in as little as 5 to 10 years. I would focus in school on developing aptitude for an area of medicine that you truly enjoy, regardless of its current level of popularity, with an eye out for acknowledging one's compatibility with the lifestyle choices as well associated with various subspecializations. Oftentimes we overlook that, but I think it's important to be realistic with the life that you're looking into being compatible with your interests. Thus, the overlapping of these domains, good aptitude with a quality of life that will sustain you moving forward, will result in optimal selection of a path in medicine for a very bright future. I don't believe the naysayers, and you shouldn't either. You'll hear all kinds of people say things about medicine, this and that and the other thing, but it's an extremely rewarding profession. Does it take lots of time, effort, and diligence? Absolutely. But the rewards of seeing your patients do well directly or indirectly through bench research can be quite incredible. You can always channel a bright path in medicine. I truly believe this, and I want you to. Medicine will always be a challenging occupation, but there are plenty of examples, especially given the nature of the incredible people involved with medical care, to help us persevere. When I was hooded at my own medical school, Loyola Chicago Stritch School of Medicine, it was by a neurosurgeon who really helped us remember this phrase: be the sort of doctor that patients feel better as soon as you walk into the room. I foresee every challenge as yet another opportunity to prove resiliency and develop troubleshooting ability that will benefit me as a provider for years to come, and becoming, in effect, that physician as that neurosurgeon described at my hooding ceremony. Technology can be a double-edged sword, but I personally believe an outgrowth of this pandemic has been an increased comfort level amongst us providers and patients alike with the use of remote-based technologies in improving and certainly expediting patient care. And thus, this phrase takes a new effect in a virtual sense. I would modify the aforementioned phrase of this neurosurgeon to also include being the sort of doctor that patients feel better as soon as you log into Zoom or whichever platform you're using to help with remote access technologies in these pandemic times and beyond. Webside manner is as valuable as bedside manner. And I have readily learned patients would much prefer a qualified physician with a good website manner than with a mediocre bedside manner on any occasion. We all have a tendency to define success a little bit differently. I seek to keep my definition within the confines of my philosophy as a medical doctor, which is I would ultimately define success as quality patient care. Too often we get caught up in being overly focused on documentation and other more tangential matters, and although these other items are often very relevant, we cannot lose focus of our primary role in providing timely and appropriate care. This involves triaging both in our medical practice and our personal lives to accomplish urgent tasks urgently as they come. The pandemic has exacerbated these occurrences, but I am honored to be amongst those in the Nassau County Medical Society and throughout the state of New York who have persevered and made our county and state withstand the test of time in providing top-notch patient care delivery. I hope to sustain and further improve this pursuit within my own medical practice moving into the year 2022 and beyond. Thank you.